For the last episode of the Fall Prevention Lecture, we will discuss the newly updated Fall Incident Report form that we will use and accomplish after witnessing a fall. To begin, let us have a quick recap of all the fall prevention lectures. The first episode discussed the overview of the fall prevention program, the definition of fall and their types. We also reviewed the International Patient Safety Goal number 6. We introduced the Fall Prevention Committee and the fall assessment tool that we utilize to identify patients' fall risk. In the second episode, we talk about the necessary procedures and management during a fall incident, while the last episode identifies the responsibilities of our doctors and nurses during and after a fall incident. The Fall Incident Report form states the cause of a fall incident and the corrective actions taken to minimize the risk of fall incident and other related injuries. As a safety document, the forms can also be used outlining potential safety hazards that can be identified and improved to promote safety to our patients, guests, and to our healthcare workers. Always remember that all fall incidents must be reported within 24 hours of discovery to the Environment of Care Department. For inquiries, you may call local number 6565. Now, let us discuss each section of the Fall Incident Report form. This form consists of 3 sections. Section A will be filled up by the nurse, head nurse, or supervisor. This section consists of the following information: the actual date and exact time of fall, the reporting date, patient's complete name, birthday, and sex. Also, take note of the patient identification number, age, patient status, whether the patient is admitted or undergoing outpatient procedures within the hospital. Furthermore, the obtained score from the fall scale. We use the Morse Fall Scale for adults and Humpty Dumpty Fall Scale for pediatric patients. Our nurses must obtain the patient's vital signs during the incident: the blood pressure, heart rate, respiratory rate, temperature, and the pain scale. Nurses also need to identify the type of fall, whether it is an actual or a near-miss fall. During the assessment, the nurses must document whether the fall may be considered as unwitnessed if the incident was seen by a relative, guest, or a healthcare worker found the patient on the floor. It may become a witnessed fall if the healthcare provider has seen the incident while doing nursing care to the patient. It is also documented whether the patient is doing or trying to do an activity before the incident. To complete the assessment, nurses must also check if the patient sustains a major or minor injury associated to fall. The attending physician or resident on duty will accomplish Section B of the form. Physicians must identify the contributing factors. A medical history will be done to know whether the patient has a history of fracture or sustained a previous fall within a year. Physicians may also check if the patient got amputated because of a medical condition. The setup or other items in the room may contribute to the incident. And lastly, check if the patient is on restraints. The fall precaution intervention must be in place at all times. If this precaution is present during the incident, kindly state all precautions done in the form. We now move to patient assessment. Physicians must know all the predisposing conditions affecting their patients. A patient may sustain fall-related injuries because of these. It is a must for all physicians to know more about their patients who may become vulnerable from falling. Check if the patient is experiencing vision and hearing deficit, hypertension, stroke, neuropathy, cognitive deficits like delirium and dementia, diabetes, movement disorder, fever. Patients may also experience weight loss, dehydration, new fracture, shortness of breath. They may also feel a decrease in activities of daily living performance, incontinence, and other conditions that can cause the incidence of fall. The physician or the resident on duty should also check the following medications taken in relation to fall, anticoagulants, anticonvulsants, antidepressants, antihistamines, antihypertensive agents, benzodiazepines, diuretics, eye preparations, metoclopramide, muscle relaxants, narcotics, nitrates, NSAIDs, oral hypoglycemic agents, proton pump inhibitors, sedatives or hypnotics, steroids, and other medications that may affect the patient's ability to stand or move freely. We now classify the type of fall. Put a check on the box if the patient experienced accidental fall, anticipated physiological fall, unanticipated physiological fall, or intentional fall. Physicians may also illustrate the fall-related injury if present, by putting a mark using the figure in the form, for documentation. If there is any involvement of equipment, restraints, or environmental factors during the fall incident, you may call the Environment of Care Department at Local 6565 to evaluate the physical setup of the location, and for them to accomplish Section C of this form. Was fall management provided to the patient? If yes, kindly check the box, then check no if there's none. Then, the physicians may write the incident or narrative in detail in the form. Once the form is accomplished, the nurse in charge will prepare and sign the form and be validated by the head nurse or the supervisor and by the physician, or resident on duty. The Safety and Environment Specialist will fill up the last section of the fall incident form, to assess environmental issues present during the fall incident. The Safety and Environment Specialist will assess the following: the possible root causes that may lead to the incident, contributory factors, and environment and equipment issues. They will also check if the patient uses any assistive devices. Are there preventive measures in place or done before the incident? The corrective measures will also be identified to prevent future occurrences. Finally, all environmental findings will be stated in the recommendation, if there are any. The ECD specialist will sign the form. Take the lead. Safety comes first. Thank you for completing the fall prevention program. Kindly accomplish the quiz and the evaluation right after the video.